Welcome to another episode of the Wealthy Podcast. I'm your host, Shauna Nyrose, and today I am sitting with Shelagh Turner, who has been a dear friend of the KGH Foundation for many years. We've worked together on multiple projects in a very important area of healthcare, mental health care. Shelagh is one of the best people to talk about when it comes to mental health care in our community, and she's going to share some insights into why it's so hard to access services and what are some of the solutions, the really proactive solutions that we're working on together that are going to really move the needle when it comes to mental health care in our community. You're going to want to listen. I don't even know where to start with this intro today because the intersections with our guest are multiple and so intertwined. It feels like she has just always been part of our KGH Foundation family. Shelagh Turner is probably one of the foremost authorities on mental health care in the Central Okanagan that you will find. In 2017, as CEO of CMHA Kelowna, Shelagh was instrumental in initiating a first-of-its-kind collaboration with the KGH Foundation to raise funds to bring Foundry, a one-stop youth mental health care center, to Kelowna. Then, in 2022, driven by a significant increase in mental health challenges across all demographics, exacerbated by the COVID-19 pandemic, we worked together on the We See You campaign to raise $1.7 million to provide immediate support for overburdened local mental health care programs, and importantly, to raise seed funding to drive long-term systemic change through collaboration among key community organizations. And just when Shelagh thought she could ride off into the sunset of her retirement, we called again. This time to drive a very special initiative we knew she just wouldn't be able to resist. And so here she sits today. Welcome to the Wealthy Podcast, Shelagh.
Thank you, Shauna.
We have a lot to talk about. I'm so excited to have you. But before we sort of get into the work and the passions that we have to advance mental health care in this community, I kind of want to learn a little bit more and share a little bit more about you and like why all of this matters so much to you. So we have an opening tradition on the Wealthy Podcast. Can you share how you got here? How did you become interested in healthcare, mental health care, not-for-profit, leadership, all of these things that you bring, the value of what you bring to our community? Where did it all start?
Yeah, good question. Well, I think I probably subscribed my life to John Lennon's, his quote, life's what happens to you while you're busy making plans. And so I think my life is just a series of flukes and sort of bumps and, adventures, I guess. So firstly, I am one of those rare people that now I understand is a rare person that comes from a fantastic family, loving parents, great extended family. And in that, they instilled some really great values, values of kindness and community, hard work, and integrity, I guess. And I think, I wasn't conscious of that, but I think that's, sort of how I've approached things. One other thing that my family was adamant about was the outdoors, and a love for the outdoors, and a love for the importance of physical health and sport. So I learned probably some of my biggest lessons in sport.
What sport did you like?
I played them all.
Oh, you did?
Mm-hmm.
Wow.
Yeah, but I sort of really focused on volleyball. I played volleyball through university. A lot of, I think, failure probably the biggest lessons through failure, lots of success, but, and then team, understanding a bit about people, what motivates people, and hard work. So all of those things in sport, really important. And then also, the connection between physical health and mental health, that when I'm moving, I'm happier than when I'm not. And so those sort of things were twigging. Another value or really important thing in my family was education. And so I had the good fortune to be able to go to do my undergrad at Queen's and in urban geography. And then after that, I thought, I'm going to go be an urban planner. And as I was on the, just about to get on the bus to go to university to do my master's in urban planning, I thought, no, I need to go travel. So I spent a few years out with my thumb, traveling around the world.
That used to be a thing back in the day. Hey?
It definitely was a thing. So we're talking early 80s here. And, when I was one.
Right.
Yeah. So, and I went around the world and, travel was another gift. I bumped from one place to the next, but I was on a shoestring. So, back in those days, it was how to travel Europe or the world in less than $5 a day. Imagine that.
Wow.
No credit card. A handful of traveler's checks. And I saw the most beautiful places, but I met the most beautiful people. And I think I learned perspective. My bubble, my little Toronto bubble, wonderful family. I thought, there's people who suffer, and there's people who don't have as much as we do in Canada or in downtown Toronto. And so that really sort of gave me sort of a learning of myself in a very challenging situations because I was on my own a lot. And so there's a lot of things when you're traveling you can't control. And you learn about your love-hate relationship with control when you're in situations that you can't control. And so I learned a lot about adaptability and relationships and things. And so I think all those things were formative. And then I hope you asked this because I'm just going to tell you the whole story.
Go. Yeah, I did. Yeah.
Okay. Yeah.
How'd you get here?
Yeah. So then I was, after several years out, I got a letter. I got a letter in New Zealand. I was there and I was having a great time working and on a Kiwi farm. And I got a letter from my mom who said, "It's time."
Oh.
And then sent me an application to the London School of Economics. And so it's like, do this now. So I filled it out on a flyer and, back when you actually had to do things by hand.
Right. And like in the mail.
In the mail.
Yeah.
And I got in and into a master's in economics and industrial relations. And so off to, after, a few more months of goofing around and life lessons, I guess I was experiencing, yeah. I go to the next adventure, which was in London.
Wow.
And, met some incredible people and started to hone a sort of a strategic perspective, I guess. And, that really an understanding that everything is connected. And certainly in, when you study economics, I think you realize the connection of things. And so, I have this, it's the mid-'80s, and I'm thinking I'm going to get a big finance job because I'm so poor. And a big finance job. I'll stay in Europe and start my life.
Right.
And just as I was graduating, my best friend in Toronto was getting married and asked me to be in her wedding. So I just had enough money to get back to Toronto and be in the wedding. And so my big plan was that I was going to get a job back in Toronto, make enough money to get myself back to London and start my life.
Wow.
Well, at one of these parties that I was at, a wedding party, I would literally go around the room asking people, do you have a job? Do you have a job? Like at the time, the unemployment was ridiculous in Canada.
Yeah.
And so, we all had rejection letters coming out of the yin yang. And so I thought, well, I'm going to use my network and, or at least my friends' network.
Mm-hmm.
And so, I, did interviews in the insurance industry and the finance industry and blah, blah, blah. And nothing sort of really excited me. But at one of these parties, one of the people I met was the head of the Canadian Mental Health Association for some reason. And I said, do you have a job? And he said, yeah, we do. What do you know about mental health? And in my head, I'm going, oh my God, I know nothing about mental health. I had never taken any sort of health-related courses. The best I knew was industrial or organizational psychology.
Right.
And which was certainly a passion area, but that's hardly like what he was looking for. Mm-hmm. So I said, my outside voice said, a lot.
As we do.
As we do. It's that smile while you're making it, smile while you're
totally,
faking it.
Yeah.
And so he said, come and see me on Monday. And I think that was like, that, is it the movie Sliding Doors or something? I mean, that was that Monday was a pivotal sliding door for me. So I went down to the CMHA Ontario Division office and I go for my interview and I got the job, which is unbelievable.
What was the job?
The job was as it's called what was it called? A management consultant.
Okay.
So I was consulting for CMHA branches around their business strength and which, I was a little lean on. I knew the theory, the practice was a little rough. But again, in the smile while you're making it.
Yeah.
Anyway, so it was nothing really to do with clinical work. It was really about the organization, how the organization
Which
was.
just makes sense. That's kind of where your education had
Absolutely.
pointed you.
It totally made sense.
Yeah.
But the job, the person whose job I was taking was trained me and turned out to be my husband.
Oh.
So I was not looking for love.
Doug
and I wasn't.
Rankmore enters the scene.
He did. He did.
No way.
Totally fluke. I was not in, it was just one of those moments.
Oh.
So, it wasn't, for me, it was a little bit of, wasn't love at first sight, but it was certainly, ooh. That's interesting.
So, okay, I'm going to stop right there because there's a backstory here, which if you are familiar with the KGH Foundation, then you'll know, but maybe not everybody listening knows that Doug Rankmore was the CEO of the KGH Foundation for a decade. So prior to Allison Young being in the role, it was Doug Rankmore. And he hired me 9 years ago. And we just adore Doug. Like, yeah, he was just such a pivotal person in this organization for so many years that, again, I left this out of the intro because I thought it was best for Sheila to introduce this fun fact. But yeah, Doug's
Yeah.
Doug's a player in this movie.
Yeah, he
Yeah.
sure is. He's
Yeah.
well, and certainly in my movie, yeah.
Yeah.
So that was a sliding door.
Yeah.
So he left, and I took over his job. But
In a good way?
What do you mean?
Like it was good? Like it was like all happy? Like you were like the next in line and he
Well,
went on to something better?
Oh no, he was leaving the organization, and
Yeah.
they needed somebody to fill that position.
Ah.
And so that was amazing. But and so I had an opportunity to learn something, be a part of something great. So, I mean, that was 35 years ago or 37 years ago, and I stayed with the Canadian Mental Health Association throughout my career in various iterations. So when I say it's like a sliding door, it's like a major sliding door for me.
Yeah.
So I met both not at that moment, he didn't become my husband, but it was somebody who just changed the trajectory of my life. I thought I was going to London, and I didn't go to London. And I had this incredible, rich life, in both my career, but also in my love and personal life.
Yeah, what a beautiful sliding door.
Mm-hmm.
And I love that we sort of talked before we flicked record on this, just about flukes and serendipity. I'm curious, do you believe in flukes?
100%.
Yeah.
I mean, I think there's it's a good question. When Doug and I would talk to our kids, which is another thing we'll talk about, but, and I talk to young people who get so worried about what the future is and that they haven't got this big plan. And I think there's some calculation in one's life of, how you set yourself up. But I think you also have to be open to opportunities and possibilities, and sometimes just go for it. If and probably that fundamental understanding of who you are. If you understand who you are and what makes you tick and what how you're driven, I think that also helps to guide the decisions that you make in life. So while it's fluke or serendipity, there may be a certain element of calculation in it as well. But I think you just gotta be open to possibilities.
I couldn't agree with you more. I have 2 kids as well. One of them is in university. The other one is in grade 12. And we talk a lot about this because I agree with you. I do think young people feel this pressure to have it all figured out at such a young age. Mm-hmm. And I wish somebody had told me. I learned later in life that if you can hold space for the possibility of all the things that you don't even know are possible or that exist, but believe, that when they come up that you'll be able to be like, yes, that's the thing for me, much like you did, right? It seems like it's maybe impulsive, but it's not, because you already know sort of deep in your heart, oh yeah, no, that's the thing I've been waiting for.
Yeah.
Right? It's like when you meet the Doug, or in my case, it was the Darcy. It was like, oh yeah, no, I know that. That's the one I've been looking for. Mm-hmm. Not necessarily a fluke, because you've already sort of got the program running in the back of your head. But it's important, it's important not to feel this sense that you're going to know everything in the moment that you're in.
Yeah.
Yeah.
Well, and I'm very aware of my privilege, mm-hmm. and the fact that while I got to bump around the world, on a shoestring, I always had this confidence that I could, make a phone call to my parents and say, bail me out. And, that it was going to take, to the nth degree to make that call. But I always knew I had that. So that's very comforting.
It is.
And I also had this, probably ridiculous confidence that I could do anything. And, whether that's being a construction worker in Spain, which I was, or, slinging burgers, which I'd have, or, whatever. I've done quite a lot of crazy jobs. I always just knew that it was just a point in time, and I could do it, and I could enjoy it, and then I could get out of it, and if I felt I could. So that privilege is not for, and not everybody has that, right? And it certainly helps being born in the time that I'm born, and being white, and all of the things. So, and middle class. So it just, the deck was stacked with me.
Yeah. And I feel that too. And I appreciate the candor, and just recognizing, that for me, one of the ways that I reconcile that is, I feel like that gives me a sense of responsibility, and I think that's a great segue, because I know you probably feel the same way.
Totally.
So I know this is a big question. I want to transition a little bit to kind of like the practical application of your work and your interest in mental health care.
Right.
But you've been deeply embedded in mental health care, as you've said now, for 35 years. And specifically, I say more recently, but I know you've been here a very long time in Kelowna.
Since 1991.
Since 1991, yeah. So you've been embedded in the mental health care community here in Kelowna in the Central Okanagan. So I am curious, what is your, here we are, in 1991 you started here, now here we are at the end of 2024. Big question. In your opinion, your expertise, what is the current state of the nation in terms of our mental health? I know it's a big one, but I feel like I have you, and that's what people want to hear from you.
Yeah. Okay. Yeah. Well, can we come back to 1991, because I have another fluke?
Of course. This is your story.
Yeah. Okay. Well, and you had asked me in the last question, which I completely ignored. You asked me about how to fall into mental health, and so so the fluke of finding CMHA. Really, it actually ignited my passion, where I least expected it. And I think what I saw was an unbelievable group of people that wanted to make the world better. But I also saw the how broken things were. This is like 1988 or 7 or something like that, and it just was broken. And back then things were a lot more simple. But it's the unbelievable, complex and bureaucratic so-called safety net.
Yeah.
It was very apparent to me. And as I, was sort of learning things, learning how the world worked, it just didn't make a lot of sense. And the system didn't make a lot of sense. Not mental illness. That's a illness.
It is what it is. Yeah. Yeah.
But how it was, how things were set up just didn't make a lot of sense. Now I'll get back to the other fluke in a sec. But, here we are in 2024. Just earlier this month, the CMA, Canadian Mental Health Association, released a a great report on the state of mental health. Mm-hmm. It's not great. Mm-hmm. The report is great, but it actually says almost the same things that were being said in the late 80s.
Wow.
Yeah. And a lot is about, in between that time, I think our healthcare system has been so focused on the medical model and really focused on responding to crisis.
Right.
So
reacting. Yeah.
Because it's just sort of been snowballing ill health, and there's lots that goes with that. But I think we have learned as a society that if only we take a pill, things will get better. Mm-hmm. Or if we've also put doctors at the pinnacle of our healthcare system, which makes a lot of sense. Mm-hmm. I mean, they're fantastic.
Totally. Yeah.
But it's sort of
it's one part.
It's one
of
part
a bigger picture.
And the investment, so all the investments in the healthcare, well, maybe I shouldn't say all, but a significant number of the investments in the healthcare system have been at the back end, once somebody has been diagnosed or a crisis has happened. So inevitably, hospitals are going to get bigger. Mm-hmm. You'll never have enough. There'll never be enough beds. There'll never be enough there'll be enough doctors. Right. There'll be never, ever be enough of stuff.
So fundamentally, the model was flawed from the beginning.
Yeah, I think it... in the world of choices, I think the decision makers, the policy makers, the legislators, the politicians, thought that these are binary decisions.
Right.
So that it's an either or. Mm-hmm. And what we've got a healthcare system that is constantly, and every system that is constantly playing catch up because we, have not addressed prevention. We have not supported helping people sort of take agency over their own health care and their well-being. And we've sort of said our institutions will take care of that. Mm-hmm. And, I think now we're in a pickle.
Learning differently. Do you think part of that, Sheila, is that mental health has been poorly understood?
Yes.
Okay.
Yeah. And I think there's a big difference between mental health and mental illness. Well, they are part of a continuum.
Right.
So you and I experience mental health all day, every day. Some good. And that changes probably on the hourly.
Sure. Yeah.
Sometimes you're
nervous.
You're nervous,
right?
or you're high.
You're going to do a podcast. You've never done it before.
Yeah.
You're right?
Yeah, or you've accomplished something, or your kids have accomplished, and you're really great, or somebody said something to you, or somebody honked and called you something in the car, which happened to me recently.
Oh yeah.
And that can just like plummet your how you feel. And then there's mental illness. So. Mental illness, these are they're health problems, health challenges.
It's like an ongoing, I mean, it's not so different when you think about it from physical health, right? Like, we all sort of, I got a sore thumb today, most of the time I feel pretty good. Sometimes I'm not feeling great. In a sense, we have to self-manage that, right? And we do, and I think also some of the knowledge that we're starting to get about prevention and early intervention around mental health may be seeping into how we treat physical health as well. So long, same thing.
Same.
Like, oh, I'm fine. I'm not broken. I don't need a doctor, right? Oh, but mental health, it was this distinction between what is normal and what is illness.
Yeah.
And the illness piece, poorly understood.
Mm-hmm. And, working with the Canadian Mental Health Association and being the CEO of CMHA Kelowna, is just such a gift all the time. And not only the people that I got to work with and work for, it's the people who came in the door. And I saw such incredible courage. So lots of folk, you don't come to CMHA, when you're feeling at your best. So lots of people experience mental illness. They had diagnosed mental health issues or mental illnesses. But they're probably the most mentally well people that I've ever known. Like, they really thought about what's going to keep them well. And they taught me and my team every day about what they needed and how our organization could help people. And interestingly, the things that keep people well have nothing to do with healthcare. So, I'm quite passionate about housing. It's a fundamental thing. If you have a decent roof over your head, it's stable.
Game changer.
So, that just seems like a no-brainer.
Inextricably linked to conversations around the mental health care crisis.
Yeah. The lack of housing, yeah. If you have, of course, equitable access to health care, so you can go to when you need help, you can go find that help. That goes a long way. I'll get into that in a sec. There's a bit to unpack there. But when people have access to, nutritious food, that helps immensely.
Totally.
Something meaningful to do, a living wage, at a bare minimum, a living wage, money in their jeans, that helps.
Yeah.
And
all of these things that you're sharing are, I guess you could say upstream, right? Like, these are things that you can put in practice, like, given the conditions, right? That if addressed upstream will mitigate
totally
issues downstream.
Well, I remember Tim Richter with the Canadian Alliance to End Homelessness. He used to say, what we need to do is shut the front door to people experiencing homelessness. So get people housed. So you stop people coming in the funnel.
Yeah.
Shut the front door. Address people well when they're in the house or, they're in the system.
Yeah.
And then open up the back door so that people can grab a life.
Right.
So, I think prevention is really about shutting the front door and, stopping people from languishing in ill health or suffering. Like, get access to the things they need quickly. The early intervention is, Foundry is a great example of a program, I don't know,
like
what
a
you call
support,
of a series of supports that try and intervene early, so that you can grab a life.
Yeah.
Now, and the other thing I think, in terms of like the determinants of health is supporting people when they're young.
Right.
Like providing as much possible support in the early years. The trajectory is really good. We're learning so much
about that too now. And it doesn't really matter what socioeconomic background you come from, although there are more, I think those that are in sort of do not have the same privileges as maybe you and I had are more at risk. But, we're learning a lot about how traumas in childhood really do have a massive impact and put you at such a high risk, or people at such a high risk for those mental, like really life-altering mental illness later in life. Yeah. Right? So focusing our energy and our effort on upstream or early intervention for young people makes so much sense. Yeah. Yeah.
Yeah, all that stuff does. And then, of course, some, meaningful connections. So we hear all the time right now about how isolated people are, sort of the epidemic of isolation. And, I think people have become so disconnected, and, whether that's the external circumstances or it's just, what's going on in people's lives. We need a lot more connection with each other. And and
I think it has a lot, that particular issue has a lot to do with the way that we have, embraced and evolved technology so that everything is so convenient. I have a friend who doesn't even makes it her mission to not leave the house. She can do all of her grocery shopping online. She can do all of her Christmas shopping online, take care of all the banking, the bills. All these things are now just available, not to mention the social connections, which, I think we're learning now, we're in a little bit of hot water around that we can't just have mediated relationships. Yeah. They have to be in real life. Yeah. Right?
Yeah. So it's challenging, right?
So many of these things are sort of running programs in the background, which are contributing to what I think is broadly being termed a mental health crisis. And it's not unique to our community. I think it's broad across our country and, North America and all around the world.
Well, and that report on the state of mental health said that, 3 times more Canadians or Canadians are 3 times, what is that stat? Yeah. It's that 3 times more Canadians are feeling poor mental health and than they did prior to the pandemic. Mm-hmm. So
that's significant.
It is significant.
And we're not, and this is the thing too that I want to underscore. We're not just talking about, I think sometimes that stigma, I think we've done a lot to kind of try to blur the edges around that stigma, but we're still sort of fighting with it. The stigma around people with mental illness are, those experiencing homelessness or with substance use issues, but it's not. When you have 3 times as many people reporting struggling with their mental health, only 5 years later, whatever it is now, this is everybody. These are our neighbors. These are our colleagues. These are our friends, our loved ones, as well as, all of those groups, marginalized individuals who have, it's been well known, and the crisis has been simmering for them for decades. Yeah. Right?
Yeah, absolutely.
So, sorry, go ahead.
Well, I think that if we addressed poverty, so people who are experiencing poverty experience higher levels of poor mental health than others.
Of course.
So if we address poverty, and that means going back to those determinants, if we help people get a roof over their heads, or just some of those basics. If we look after the most vulnerable in our community, that will go a long way to looking after the well-being of our society.
Mm-hmm.
Now, that's controversial, and I'm not saying that, everybody needs to, like, universal basic income is the way to go. I'm not saying one thing or another. I think it's all the things.
Mm-hmm.
And, we're struggling in our communities.
Yeah.
And, if we don't do something about it, our healthcare system is it's just going to be a tsunami.
Mm-hmm.
And people, we're burning people out. Our workforces in healthcare and pretty
mental
much
health care, like even mental health care programs in community.
Oh, incredible.
Yeah. The burnout,
incredible.
overwhelm.
The people have been languishing longer, and so the trauma that my staff at CMHA used to feel when they were dealing with vulnerable folks, it has an impact.
Mm-hmm.
And really, as an employer, it was very difficult to, certainly the nonprofit sector, we don't have a lot of tools in our toolbox.
Right.
We have, work on great corporate culture and, employee assistance programs and, all sorts of things there's some things we can do, but we're letting people languish longer. And so the folks that are in our services are more complex.
Acute, yeah.
And acute. That's it.
Yeah. And I think a lot of people that may have clicked on this episode with an interest in mental health care specifically are probably feeling like I should ask you about why it's so hard to find help. Right. It's anecdotally, we are, Foundry feels like as much of a baby for us, I think, as it probably does for you. But we're hearing, that even there it's full, like the access is really hard. Access to services there's long wait lists, likely in part due to this tsunami. I think it's arrived. And that there just isn't enough funding. There aren't enough services. There's not enough care providers to deal with the downstream, more acute cases that are just, it's like almost like coming up like weeds. And so can you speak to that, Shelagh? Like, just honestly, as somebody who's been working in this, help people understand the environment that we're trying to figure this out in.
Yeah. Well, I like I said, I think that the vast majority of available funding and choices around that have been put on the downstream, like mental health. So just to go back to that, in Canada, 6% of the total healthcare budget is spent on mental health. So, and of that, we could argue we need a bigger piece of the pie, of the healthcare pie. And they're saying it should be at least 12. And I think I said, back in the 80s, we were saying the same thing. We were advocating, CMHA, a big advocacy organization, advocating for the same thing, a bigger piece of the healthcare pie.
And it hasn't changed.
It hasn't changed. And it's always been sort of 7, 8, 6%. It's troubling, right? So that investment is low. And then how that pie is divided, like that slice is divided, it would be 80% would be for acute care treatment, downstream funded initiatives.
Which is the most extreme, the sickest cases.
Well, yeah. And it may be. That's where the investment of supports are. So, and very little for upstream or prevention. And then we were talking about other things that impact your mental health. So housing, affordability, the livability of cities, and access to like affordability to food, all the things, and those. There have been investments for sure, but we have made choices that will let the free market take care of a lot of this. So, we're dealing with some challenging affordability issues that impact health and well-being. So that just means more people are trying to access fewer, not an unchanged service.
Yeah, the same level of service.
Yeah.
Yeah.
And so they're languishing, not getting access to we have GP shortage or primary care.
Right.
Now, we're trying, incredible people in the systems are trying really hard to change that, but it's always catch up.
Yeah.
It's always catching up. So you never feel like you're on top of things.
Yeah.
So
you're chasing it.
And the question about access is it's an interesting one. I just think it's complex.
Yeah.
And it's going to take not some of us. It's going to take all of us to figure it out, which is probably a good segue
I was just going to say,
thrive.
Yeah, I love, it is a perfect segue to thrive. So we've talked about, the mountain we're climbing, but one of the values that we have, that we share, is okay, great. We need to have a real clear understanding of what the challenge is. What are we going to do about it? So the cool thing about the We See You campaign, and this is going to lead me to thrive, that the KGH Foundation, and so I will say that partnership for We See You, that campaign, that $1.7 million effort, just for everybody listening, it was, the KGH Foundation was sort of like the fundraising muscle, but it was a partnership with many different community mental health care providers. CMHA Kelowna was one of them. Kelowna Community Resources was one of them. Foundry, the Children and Youth Advocacy Center. And basically that campaign was designed to provide at least a little bit of funding immediately for those organizations that were just, like you said, just struggling to keep up with the demand. But there was a reserve. I think it was like $1 million reserve for that campaign. So more than half of it was set aside for system change. You've just scratched the surface kind of a little bit around some of the issues with system, but I think we kind of all know it's broken. So thrive, and I'll say I feel like that's fair to say. I don't know who would argue with, somebody probably would. But what came out of that then was a commitment on the part of the KGH Foundation on behalf of all of those who gave to that campaign in good faith to take steps towards system change that would actually start to address some of the elements that you're talking about with regards to the social determinants of mental health care, also with regards to early intervention and prevention, and recognizing, as you've already alluded to, that this is not a siloed conversation, that there needs to be many voices at the table. So tell me about Thrive.
Well, sure.
Because it's just as much, I will say, this is just as much your initiative. I will say your baby. I mean, your boots on the ground with this project.
Yes. Okay. Well, let's go back a step. Another sliding door. So I know that Allie Young, she was pretty, when she used to talk about in the We See You campaign that, when she talked to donors, they were so incredibly generous. They'd say, of course we want to help, but it just never seems like mental health is getting any better. And so, donor after donor was saying, okay, what can you do about that? And so I think Allie put into her mind, okay, we've got to do something different. So she sort of was thinking about collective impact and, how do we do system transformation?
Right.
So that's swirling along. The sliding door is that, I in 2022, I retired, and I've been thinking about collective impact. I've written papers about it, and I've tried to influence my whole career around getting people together to have conversation about similar issues that are important, and which is really what collective impact is coming together.
It's a model of cooperation.
It really is.
Yeah.
A model of cooperation and then resourcing it. So after I retired, Allie approached me and said, what would you do? And if you had $1 million, and, it's like, perked up my ears and
the Bare Naked Lady song.
Yeah, okay. Exactly.
Not a green dress for you though,
or a goat, or something like that.
A llama,
or an emu. So we had this really incredible conversation about. She actually hired me and said, "Would I do a review of what's getting in the way of system change and in the mental health system?" And, that process was amazing for me because I got to actually go back out to my colleagues in the community and ask that question. And people are just so incredibly committed and thoughtful and I'm a warrior for the nonprofit sector. They're amazing leaders in the nonprofit sector and the work that's done. But, I got to meet with politicians and people in institutions the school district, Interior Health, the MCFD, all over. People really cared about this problem.
at all levels.
At all levels.
Yeah.
And had really incredible ideas, but there are significant barriers, and part of those barriers are the medical model, the way funds have been invested, and then there's also the funding, how funding happens, how it rolls out in communities. It's usually pretty strongly kept, something like that. Accountability is so challenged. Everybody is accountable to someone, but it seems so diffuse,
right,
who they're accountable. And that sort of continues to perpetuate some silos.
Right.
And then the workforce, the unbelievable, this is 2022, and we were just sort of seeing the tip of what was happening in the workforce in healthcare and human services. And people are just so burnt out. And so lots of vacancies in positions and lots of turnover, and all of that really just creates a lot of churn and disruption. And so, and uncertainty. And I think, there was this convergence of, we know so the problems are big and bigger. Why doesn't KGH Foundation take some responsibility to bring people together and have conversation, and let's start workshopping what's gonna resolve this.
And what do you think was different about this time? Because we've heard of these kinds of initiatives happening in our community in the past. What was different?
Well, I think the strength of KGH Foundation as a non-service provider,
right.
The vision of the foundation and the relationship with philanthropy and the reputation of the organization. I think that sets the KGH Foundation up well as a backbone. A sort of pretty neutral party, in this. It's not, other initiatives have, there's always been a concern about non-neutrality. And what is neutral anyway? Right. And does it really matter? But, no limited vested interest or conflict of interest.
Yes.
So I think that
I wasn't just fishing for that, by the way. But thank you for saying that.
Well, and I truly believe it, and because I've been a part of all of these initiatives, and I think the other part of the challenge has been there's the setup, the issues, the people who are driving it. And also I think there's always an expectation that people will do this on the corner of their desk.
Yeah. And
what's bold about the work that we're doing with KGH Foundation, in my opinion, and this is not rocket science, but it's or countercultural in that the foundation has invested in people, resources, human resources to support the work that's already out there, going on out there. So bringing people together is not, on, a nonprofit organization's, to-do list. Right. It's on my to-do list to build those, create those spaces for people to come together and then start talking and moving issues. So, one of my strengths is sort of taking vision to action, and I can land a plane fairly well. I've kind of done that. I'm also kind of good at flying a plane that is kind of looks like a boat. Or it doesn't look like anything. I mean, I can kind of, definitely a flying turtle. So and I have lots of the good fortune of being in this community for a long time is I have lots of relationship with people. I'm testing those relationships a lot, and people are just unbelievable. They coming together and very thoughtful discussion and very solution focused. So it's a real privilege to be working with the foundation on this initiative to, and have some resources like that. So there's me as a catalyst and a few others of conversation, but also then the foundation has said we can provide some seed funding to good ideas. And that's there's not a whole lot of restriction around that it has to be one thing or another. It's based on the conversation, based on what the collective of those conversations decides. So we've been doing some amazing work with the Child and Youth, Kelowna Child and Youth Advocacy Center, who's sort of taken a lead on some work in they do work in the intimate partner violence space, but two key initiatives around some community development for the IPV, intimate partner violence sector, and another initiative on the youth, on youth dating violence that kind of came from those discussions that we've been having as a group.
I'm going to stop there because when you shared a little bit about, so just to overview, the collective impact initiative has now been officially renamed Thrive Okanagan.
Yeah.
And Shelagh is the lead on that project. And
oh, sorry, I should have probably explained
that's
that.
okay. Yeah, and so Thrive Okanagan basically has a mandate to convene tables of people that have an interest, in the delivery of mental health care in our community.
And broad mental health care.
Yes, and solving some of the issues that we're facing with regards to the barriers, the system change that needs to happen. And it's been extremely fruitful. And so out of that have come these small projects that we've been able to seed fund initially, that are really, what I love about this is it's hyper localized work.
Mm-hmm.
So it doesn't mean that the challenges that we're trying to address don't exist more broadly, but the work is being done in community. So share a little bit about the intimate partner violence, not intimate partner violence, sorry. It was the dating, say it again. I don't want to mess it.
Youth dating violence.
Youth dating violence.
Like, who thought that was a thing?
Who thought that was a thing? But tell me about that thing.
Well, so we invested a little bit of money to do a lit review. So out of conversations with folks around intimate partner violence, like the community, we sort of, somebody said, well, what about the youth? And everyone went, oh, that's a whole different thing. And so, or it's a whole thing in itself around the impact of that on youth. But so we thought, we talked to folks and they said, oh, let's do a little lit review. One of the things that's kind of curious is that there's lots of young people who are showing up at school talking about, violence with their
partners.
Yeah, their partner.
Boyfriends or girlfriends.
And boyfriends and girlfriends and others. And teachers are kind of going, I don't know what to do with this. Who do I send this to? And then, there's sort of this review of policy, and there's a lot of policy and no policy on how to deal with it. There's resources, no resources on how to deal with it. So this will mushroom. We're at the tip right now.
But it's actually been identified as like it's not just one or two kids.
No, it's a thing. It's something more substantial. And so we're not sure where these conversations and this lit review and what the next steps are, but there are next steps for sure. And that will result in system change, and they will result in policy change in organizations, and it will, like, maybe not tomorrow, but in time, and we will keep this moving so that we start to address that, and and understand it more. So I just want to go back to one of the things with Thrive is that Thrive Okanagan is that people said, that what they're missing is relationship, and within relationship, they're missing trust. In order for change to happen, you kind of have to have some trust, a collective change. And so this is really what we're doing with Thrive is we're trying to evaluate the value of relationship building in system change, and relationship as an intervention and in itself, and then we do have a developmental evaluation for the whole process, and so we will be we will be learning and changing as we go as a collective, but we'll also be analyzing, relationship kind of is a special sauce of so much.
And it just sounds like everyone is ready for that.
Yeah.
So. This hour has flown by, And I'm just so grateful to be able to sit and chat with you. I've learned some things today I didn't know about you. I'm really excited about the work that you're involved in with Thrive, and even some of the work that's coming out of that. We have Melissa Feddersen coming on the podcast in a couple of weeks, and she's going to share about a project that was basically initiated and funded by Thrive. So we're really trying to put some color around, I know people are probably tired of hearing like we're just talking, but it's important to understand how this is different and how there's a clear strategy around these tables and convening this time that is actually netting out practical application in our community in real time, not tomorrow, not in the future, but now. And that's really important.
Yeah. And we have such incredible assets in our community.
We do.
And it's sort of maximizing those assets, what we have, and then we can start to advocate for what more do we need, and where do we need those.
And one of the things I love about you, Shelagh, is that you're all, we'll sit around the table, we'll talk, sort of like, oh, here's what's going on, here's opportunities, here's blah, blah. And you're one of your first questions always is, okay, so before we get too far down this, let's see if there's someone else doing this already in community, right? Let's audit and see if there's already somebody doing this that we can work with or support or help or, scale or whatever it is. I love that approach rather than let's start something new and do it again or, be redundant. I love that about you.
Well, and thanks. I have a dream.
Okay.
It's a pretty simple dream, actually. I have a dream that if everybody in our community, and certainly our community of health and social care, would ask that question first. Who else is doing this? And act upon it, find out. And who else needs to be a part of this is the second question.
I love that. Okay. I know I'm out of time. Okay, really quickly.
I thought this was a 2-hour podcast.
Oh, did you?
No, I'm just kidding.
Boy, I would sure love that.
Oh, God.
I know. Okay, we'll stick to an hour. Okay. Jason's looking at me like, no. He's so mad. He's like, don't make me be the bad guy. He's not the bad guy. He's a good guy. We love the Jason. Okay, so really quickly as we wrap up, I am curious. We've had a beautiful conversation about an area of healthcare that has merit and value and impact for all of us, because we all have mental health. How has your definition of health, or how's your definition of health and what constitutes healthcare changed over the years as you've done this work? And you've gotten older and been in relationship, being a householder, having children. How's it changed?
Oh gosh, I think with time, I think you realize that everything is interconnected, and maybe that's the Buddhist in me. So I think that is like, when you're young, you just sort of,
if
take everything for granted.
Fix it. Yeah.
And certainly at this stage in my life, I'm thinking about, I don't bounce as well as I used to, personally. So I want to be a little more sensitive to looking after my health. So that's changed. That's personally, but certainly the system is, definitely things are interconnected.
And that's what we must push for. Yeah. That's why I like this. This podcast is part of that solution, just by virtue of the fact that we're inviting so many different voices from so many different aspects of healthcare to sit in that chair. Everything is connected. And that's what we hear over and over again.
I might also add that, now this is what takes it into a 2-hour podcast. But I might also add that I think there's a sort of this growing and happily, this growing awareness that we have agency over our own healthcare, our own well-being. And, life is a series of choices. Sometimes we have fewer choices, depending on where you sit or where you live or who you were born, where you were born, what family. But, we all have to take responsibility for ownership over our own health and well-being, and then not give it away to a healthcare system, which is a fabulous system, the fabulous people that work in it. But we know our bodies and our minds the best. And so taking agency, I think, is...
yes. Definitely another hour on that one, but I agree, and we share that. Definitely, really implore our audiences and our listeners. I've been very out there with my health challenges that I've experienced in the last couple of years. There's no one is going to do it for you. Yeah, we have to take responsibility for our own health and well-being first, and be fiercely protective of it. I love that.
In the first place. Before
it's broken. Last but certainly not least, what areas of your life, your health, do you feel wealthy? And I say wealthy in the context of how we define wealth, which is that totality of health.
Oh, I am the luckiest person alive. I'm so grateful for the career that I've had, the family that my children, my partner, my friends. I think one of the themes that has emerged in your podcast is that, along the interconnection, is that we all, I didn't just start being me. I'm an amalgam of so many other people, the good, bad, and the ugly. And I'm just so grateful for the mentors that I've had, whether they knew it or not. And the shoulders of the many, many people that I stand on. I'm just so grateful for that. And to have my own health, I feel like I'm one of the few people that is not on any medication. Woohoo! And I hope to keep it that way. And I'm so grateful for living in this unbelievable community. It's so beautiful, physically beautiful, and so fun and wonderful to be able to get up into the mountains and hike. I think I'm the Sasquatch up there that many people see. But I'm just so grateful. Yeah. And my career, the experience of getting to work with the most incredible folks, volunteers,
and doing work that really matters.
What a fluke. I had no
you and your flukes.
But I had no plan. And then, when you're at the back end of your career and I talked to so many people who've had these very wealthy, financially wealthy careers in something that didn't have any meaning. And they just there's a hole in there. Lucky me on that sliding door. I wasn't looking for it, but I'm so grateful for it. Yeah.
It has been a pleasure, Shelagh, to get to know you a little bit better. We've worked together for a long time, but we've never really had an opportunity to sit down and chat for an hour.
Yeah. Nothing like a couple of microphones.
Right. It's not so bad.
No, it's not.
congratulations. I also want to just say, I know you just became a grandmother.
Yes.
Yes. So wonderful for you and Doug and your family. Just all the love for all that you guys are contributing to our community. And thank you. Thank you for joining me.
Thank you, Shauna. It's been a pleasure.